Hello, everybody. Welcome. It is our June live Q&A. I'm Angela, your friendly host, here with our favorite, Dr. Kat, who is going to be, it's the girl hour. We are here to man the fort today. The two of us, Dr. Kat, obviously with all of her medical expertise, will be answering your questions. So start adding your questions into the chat if you can. And we'll get started as soon as we can. Dr. Kat, go ahead and take it away.
Sure. So for those of you who don't know me already, you may not have seen my face around some of our social media ads, things like that. I am Dr. Kat Brown. I'm a board certified OBGYN, and I live just outside the city of Philadelphia, which is where I was born and raised. I spent a lot of time in the Army moving around, taking care of women all across the country in the Army, and then some Army wives too, and then settled back in the Pennsylvania area to take care of patients here. So you may notice I'm wearing scrubs because I'm actually on call at the hospital tonight. And so I'm kind of doing double duty here. But I also take care of patients at Winona in the state of Pennsylvania, in Florida, Michigan, and also Hawaii as well. So I've dedicated my life to women's health. And, I feel really strongly, especially about perimenopause and menopause right now. I feel like this is the time that we need to empower each other, educate each other, because I'm also going through it with you as well. I'm not just the doctor taking care of you. I'm also a patient of Winona as well. So something that is, interesting as well. So normally with each one of these Q&As, we talk about a topic that's, kind of important, or maybe if an article comes out, Dr. Green and I will kind of talk about that a little bit. Breast Cancer Awareness Month, we talk about breast cancer screening. But I wanted to get a little personal this time because personally I'm going through a lot of stuff right now because I just had to get my mom hospitalized, and just between juggling that and juggling my kids and my job here, and as well as my job at the hospital, I thought it would be really important to talk about self-care and taking care of ourselves. Because I need to practice what I preach. And I think that the things I tell my patients, I need to also practice. But I think it's so important, especially for us in midlife as women. Many of us are at the pinnacle of our careers. Many of us are juggling a lot of busy things, families, taking care of kids, taking care of parents, doing all kinds of things. And often it's all too common that many of us forget ourselves. And we forget that very basic thing that, like, when you're on an airplane and they are starting to go through the emergency protocols, they always say, like, put your own oxygen mask on first before you help anybody else. But in life, we don't really do that at all. We tend to burn the candle at both ends. We tend to do everything for everybody else, and we kind of leave ourselves at the end of the totem pole, which is not always the best decision, because we really can't be our best selves for everyone else unless we really do what's good for us. And also, as we're struggling with perimenopause symptoms and menopause symptoms, this is the time that we really do need to dedicate to ourselves and really focus on what makes us feel good, what gives us the most peace, how can we feel most balanced. And really, self-care is more about, making decisions that make your life more manageable, making the better choices to help you get better sleep, to eat better. It's not just going and getting a massage every once in a while. Like, those are great too. I love them. But it's about daily choices that we need to make, and sometimes restructuring our lives to make our lives more serving us rather than serving everybody else. So that's my diatribe, I guess, my soapbox tonight. I thought it would be good to just kind of bring that up and just mention that, because I think we all, as busy women, we need a reminder to take care of ourselves. So, do we have some questions piling up?
We do. Can you hear me okay?
I can.
Okay, good. My computer likes to go between devices, and it wants to kick off audio from one to the other. And anyways, it's good that you can hear me. Sorry, everybody, for the technical difficulties. And we are supposed to be streaming this to our Facebook group, but we're having a little bit of tech. We tried this last month. We thought we resolved the issue. Seems like we haven't. So apologies if you're trying to, view on another platform. But since everybody who's here has questions, we're going to get started with those. And so let me go back. Wow, you guys are quick typers. All right, so let's start with Lizette. Lizette says she heard her doctor say that HRTs are only beneficial within 10 years of menopause. Is this true?
Really not true. I mean, I think that the important thing is there's not black and white rules like that. Every patient's experience is unique. The big thing is that there is a safety window of when to start HRT. So really, depending on when your symptoms become most bothersome and when you're seeking treatment, it's safest to start HRT before the age of 60. So for most women, most of us are going to go through menopause in our early 50s. And so that might be why they're saying that within the 10 years of menopause. But if you're 59 and you're about to turn 60 and you've been on HRT and it's doing great things for you and helping your symptoms, we don't have a hard stop that, you know, you have to stop by that age. It's just a matter of the safety of starting by that age. So the 10-year rule is not really a thing.
Yeah, that seems like it'd be tricky because what if you don't go into menopause till you're 55? You know,
right? Right.
Yeah, not everybody starts when you're 40 or 45 or what have you. So that makes sense. Okay, Laura says she's 51, postmenopausal for 4 years, just starting Bias, progesterone, and DHEA. Anything she should be aware of as she starts adding hormones back into her system? She says, I do have hormone-related migraines, and she takes I'm going to mispronounce it, rizatriptan as needed. Frequency and severity did decrease as she transitioned from perimenopause to menopause.
Yeah. So generally, when you're adding hormones of any kind, you have to give your body some grace because there's an adjustment phase. So anytime we start hormones of any kind, whether it was when you were starting birth control years ago or starting HRT now, you have to let your body adjust. So, you know, a lot of our patients have rave things to say and say they feel great within a week or two, but for some of us, we have to get adjusted to the medication first. And so you might notice that your symptoms might get a little worse instead of better initially because your body's responding to the medication. So what I tell patients, especially in the beginning when they're first starting their medications, really focus on like your day-to-day. Try to focus on staying well hydrated, which will help your body to process the medications the best. Trying to optimize your sleep, trying to optimize your nutrition and your diet, to do all the things that you can do to kind of help your body adjust. And when you have migraines that are hormone related, you might notice that you may have a change in frequency of your migraines initially, but then once we get you stabilized on a good HRT dose, usually you'll do much better. So that's something to consider with that too. Usually it's when you're younger and your hormones are like a roller coaster up and down. A lot of women get like menstrual related migraines. So that will get better typically.
Okay. We have someone asking, what are the advantages of the cream versus the patch versus the pellet?
Well, so I'm not a big fan of pellets. We don't prescribe pellets at Winona, and we're not big proponents of them just because it's an invasive procedure and it's literally a pellet that gets inserted underneath your skin, and the dosage, you know, is you're stuck with that until it absorbs in your body. So really the real question is creams and patches versus pills. A lot of people are on pills, and it really has to do with the absorption of the medication. Let me just check this page and make sure it's nothing I need to run off to. Nope, not me. Okay. So really when it comes to, I tend to think that the transdermal methods or through the skin methods are better just because you have more I guess acceptability by the body, like less side effects. So when you take a pill form of a hormone, it has to be broken down by your stomach and broken down by your liver before it gets to the bloodstream and actually goes to where it's intended to help. Whereas if you take a cream or a patch, it goes right through the skin and gets into the bloodstream directly. So less GI side effects typically, usually better tolerated. Usually we can do a lower dose when it's a cream or a patch compared to a pill. But really all the different forms of HRT, cream, patch, or pill are all equally as effective. It's more about what you can fit into your lifestyle most comfortably and what you feel like you could deal with and remember to do. Because we could put you on what we think is the best, but if you can't remember to take it, it's not going to really help you. So it's about a lifestyle and what you think would fit into your life the best.
Okay. I have an online question I want to read from, we had a few people submit, not from this chat, and there's only 4. I'm not going to read them all right now. I'm going to throw them in throughout, but there is one question that I would like for you to take a stab at. The first question is, how does HRT help in weight management, or does it?
Well, so it does, in that when we are going through the changes of perimenopause and menopause, we are in like a high stress state. Our stress hormone, our cortisol level goes high, gets increased, and we're in this kind of fight or flight mode. And what happens is when we're in fight or flight mode, our body wants to hold on to every calorie for energy, because it's like the old caveman mentality. We don't know when our next meal is coming, and you're in this stressful state. So what happens is we tend to accumulate weight, especially in the mid part of our body, like in the belly, in the menobelly. And so when we put somebody on HRT and we equalize their hormones and we get them out of that stress state, usually then at that point, their body and their metabolism start to function more optimally. And so for women that notice weight gain that was hormonally related, especially around this time, once we get them on a good dose of HRT, they start to notice the benefits of, doing all the things to try to lose weight starts to become more effective when you have good levels of hormones in your body. So it does help patients. And also we use something called DHEA as well, which is a hormone precursor supplement that when it gets broken down by your body into estrogen and testosterone, the testosterone part of that can help our metabolism, helps with muscle maintenance and muscle growth. And that also helps with weight loss as well. So for a lot of patients, the DHEA addition is really helpful in weight loss when we're taking HRT.
Okay, thank you for that. Back to our regularly scheduled programming. Chanel says her doctor told her that hormones are too imprecise to treat with hormone therapy. What would you say to that?
I would say, so yes, hormones fluctuate, they change, but what does that mean? Then if you're not going to treat with hormone therapy, you're just not going to treat somebody at all, I guess is the question. There are some
You said you just get to suffer?
Right. Like, are you just supposed to suck it up, I guess. But the thing is that when we give bioidentical hormones back to the body, and when we say bioidentical, basically just means that they are structurally identical to the hormones our body creates on its own. And so when we give the body back what it's lacking, and our bodies take in those hormones that are the same as what our natural hormones are, our body functions at its best. Our tissues are benefited by the estrogen addition. So, I would counter that if somebody's saying that the hormones are too imprecise to treat with HRT, they're admitting to you that they're not comfortable with prescribing HRT, unfortunately.
Okay. I'm actually taking some notes on that question. Okay. So Deandra says her OBGYN told her that he didn't want to put her on HRT because it's cancer causing. What do we say to that?
Well, there's some information out there, and anywhere you go, if you start to Google and you start to read, there's going to be studies that go either way. We just had a study that came out recently that actually came out showing that estrogen only HRT for patients that are able to take that, which means you don't have a uterus, it's safe to take estrogen alone, that it was actually protective against breast cancer. When it comes to HRT, I think the biggest risk out there that a lot of women are afraid of is breast cancer. But breast cancer is not the leading cause of death or suffering for women. It's actually heart disease. And what people fail to acknowledge is that estrogen is very cardioprotective and helps to protect our heart and our blood vessels, helps to protect against heart attack and stroke. And it helps to protect the health of our heart and our cardiovascular fitness. So, it's one of those things that with any medication, there are risks. Even taking Tylenol, even taking something over the counter, there are risks to those medications. But, we could all find out tomorrow that cell phones cause cancer, but yet we use them every day, right?
Poo, Kat, don't say that.
I think that when you take into account like a statement like that, you can't really think about this all or none phenomena. You can't say, well, I'm not going to use this medication because it's going to give me cancer. There are so many things that we're exposed to, and you have to look at the big picture. If you're suffering so badly from menopausal symptoms that you can't get through your day-to-day life without dealing with symptoms that are interfering with your work life, your personal life, what's your quality of life like versus your small risk of developing cancer? That we're all at risk of developing some kind of cancer as we age. That's not an if, it's a matter of when. Like, as the body ages, cancers can develop as the tissues change. But, I think it's more about the big picture and looking at each patient as an individual and talking about risks and benefits. And then as you as the patient can make the decision about what you feel most comfortable with. But I don't think it's a reason to not even offer someone treatment for that small risk.
Yeah. Especially because then it's a fear-based thing where I feel like, people it's a very black and white, and there's some gray area there, right? So you have to kind of weigh exactly. It. Okay, Robin says she's had a partial hysterectomy during a traumatic birth, and that she gained 20 pounds in the last 10 months with no change in her exercise or food habits, and she's so frustrated. Her energy is all over the place, and she wants to know what's happening. She says she feels in the dark about estrogen and adrenal fatigue, but that is what every online topic keeps leaning her towards.
Yeah, I think in this situation, Robin, the best thing to do would be to try to track your symptoms and to start keeping like a symptom diary, so that you can really get a big picture of everything you're going through. I don't know how long ago your hysterectomy was, but certainly having a major surgery like that can affect the blood flow in those areas. And I don't know what was removed. Typically, when we say hysterectomy, it usually means removal of the uterus. But if you had any surgery in and around the fallopian tubes or either ovary, that could have affected your body's hormone production too. So I think Angela's going to put in the chat our symptom tracker, right?
Oh, there it is. You read my mind. You knew what I was doing.
I thought, yes. As soon as I said the words, I could see your wheels turning and you were going to type something. So
yep.
When it comes to our female health and our hormones, the best thing to do is to track the symptoms and to look at a pattern of symptoms so that we can figure out how to treat you best. This isn't something that checking lab levels or hormone tests is actually going to be really helpful to guide the treatment. It's better to do treatment based on symptoms and adjust based on how well your symptoms are responding or not responding and adjust the dose that way. So, but it sounds like you may benefit, from HRT if you're not already taking some.
Yeah, symptom tracker is good. I think if you're like me, you go into denial. Like I can remember it all up here. It's like taking an order when you go to a restaurant. If you're a waitress, you're like, I don't need to write it down. I got it. It's like, write it down.
Yeah.
Make me feel better. Write it down. Even if you're a pro, write it down. Okay. So I'm sorry. Robin says she's only 40. All right. Well, I think still write it down. Yeah.
Yes.
Okay. Darnetta says she's interested in trying HRT. She's 50 and has been experiencing extreme anxiety, insomnia, and fatigue for almost 2 years. She was told she's in perimenopause and was concerned that if she was starting treatment, if it would affect her hypothyroidism, which she currently takes levothyroxine for. Did I say it right?
You did. Good. Very good.
Medical vocab day today at Winona.
So at this point, so the important thing to notice is that when you're on thyroid medication, as long as that is one hormonal disorder, when you have an underactive thyroid or an overactive thyroid, that's something that we check levels and we change your dosage for your thyroid medication accordingly to try to keep you in normal range. Taking female hormones will not interfere with that. Now, if you're someone who has struggled where they're constantly having to change the dose of your thyroid medication, it seems like they're having a hard time getting a handle on it, and you're going through perimenopausal symptoms at the same time. I've had some patients that once they get stabilized on HRT and they're doing better from a symptomatic standpoint with their HRT, then their doctors are able to regulate their thyroid better. It seems like the body, once everything kind of gets equalized, everything falls into place, but it won't interfere with your medication. It's not going to interfere with the levothyroxine at all.
Okay. I'm going to throw in one of our offline questions again. The question was, how do you know when or if you need your dosage adjusted?
Really by looking at your symptoms. So, if when you start HRT, depending on what your initial symptoms are, a lot of our patients come to us with a constellation of different things: hot flashes, night sweats, insomnia, brain fog, skin changes, the hair getting brittle and falling out more easily, dry skin, vaginal dryness is another one that's very common that we see. if your symptoms get better when you start your HRT and things are going great, and say for several months you're feeling wonderful and you're really happy that you started it, but then all of a sudden symptoms start creeping back, there's various life changes that can happen on a day-to-day basis that can affect our body's own hormonal response. So if you go through an illness that's major, if you lose a lot of weight or you gain a lot of weight in a small amount of time, that can definitely affect your dosage needs. Or if you're under a tremendous amount of stress. Stress activates our stress response in our body, and our adrenal glands start firing more. And so that can change what your body needs to keep your symptoms regulated. But if none of those things have happened and all of a sudden your symptoms are coming back, it just may mean that you need a dosage change, and we need to make an adjustment to keep you feeling as well as you can. So that's a conversation that you have with your doc that's prescribing, and you come to a decision together, looking at all those other things. If there's any other factors, usually we wait and for those to stabilize. But if there's nothing else going on and you haven't made any changes, that you think could be affecting it, then we change your dose and try to get you feeling your best.
So that's a really good reason to try not to be stressed out so that you don't have the fluctuation of ups and downs with the meds. Yeah, that would be probably really challenging, especially if you're under a lot of stress, to kind of maintain your dosage. Would you, if you were under a lot of stress, would that be just probably something where it would need to be increased? Like, it's not usually a decrease situation, it's an increase. Yeah.
Usually.
Yeah. Mm-hmm. Okay. Interesting. All right. Lily is asking, are adaptogens like rhodiola and ashwagandha contraindicated with estrogen and progesterone HRT?
So not technically contraindicated. Usually, I give my patients a caveat though, in that I think that a lot of our supplements and over-the-counter things that are out there, whether they be an herbal or a supplement, they're not regulated, they're not tested. So they're only as good as the source that you get them from. And so if you're not really sure what you're getting or what it's doing for you, it's one of those things that you might want to scrutinize whether or not you should continue taking it. However, if you've been on an herbal supplement and you feel really well on it and you're stable on it and everything's well, like we have plenty of patients that take those along with their HRT. The only medications and supplements that are natural supplements that I usually tell patients to be cautious with are those that contain phytoestrogens or plant estrogens. There are some products over the counter that can be bought on Amazon and from health food stores that have small doses of progesterone or small doses of estrogen. And if you take those along with your HRT, they could interfere with the way that your HRT works. There's also a supplement out there that a lot of other patients use called DIM, which is supposed to help enhance estrogen metabolism. And I'm usually leery of that because I don't really want you to take a medication that's going to affect how well the medication I'm prescribing you is going to be metabolized in your body. So if you were taking that for menopausal symptoms and it helped you slightly, and then you're starting your HRT, if you're my patient, I usually counsel you on pausing on the DIM while we start your medications, because I don't want anything to interfere with your success with the medication. I want to make sure that we know how you're responding to the medication without those other variables in there.
That's really good information, because I like those supplements. I like me some ashwagandha. I like some of those things, but that's good to know because, yeah, there's no way to really tell. Okay. Nicole says she generally feels miserable every day. I'm sorry, Nicole. That's not a question, but I feel sorry that you feel like that. I'm sorry. Robin says she's great at self-care, yet her kinesiologist says she's constantly in fight or flight versus parasympathetic. Is that hormonal?
It certainly could be. I mean, if you feel like you're doing all the things and doing all the right things to try to take care of yourself, but you're in fight or flight mode all the time, it could be a hormonal response too. So you might benefit from HRT to help with that.
So these are good questions today, because I feel like, we get some of the same ones every month, but you guys, you're bringing us new info. I like it. Well, at least new info to me. Sorry, probably not for you. Just new to me. Yeah. I'm not a doctor, so it's okay. Okay, Chanel says, how does Winona diagnose? Her biggest issues are low energy and muscle loss. I hear you. Things that her doctor isn't worried about and can't solve. But how will you know all how will you all know what the right protocol is for her? Okay.
So really the best thing, I mean, what we do is, and sorry, the phone is going crazy. That's like a notification sound from my work program. And I had to make
over.
It's like an elephant roaring, you know? Basically, I did that because if I get a chance to doze off, because I work 24-hour shifts, you know, so I have a call room that kind of looks like a little dorm room. This is a fake background because the call room's not very attractive. But anyway, I needed a sound that would wake me from a slumber in case somebody needed to get me if I dozed off, you know, that kind of thing. So
that's
pretty obnoxious elephant noise.
I love it. That's pretty good.
Yeah. Basically, how we diagnose is that we ask questions that are pertinent to your medical history on our online adaptive questionnaire, and then we have a symptom profile that we have you fill out because we want to know what symptoms you're dealing with, what have you been experiencing before you came to us, and we go through that list of symptoms and the symptom diary really. To come up with what your treatment would be. And then it's really about, like I mentioned earlier, it's about picking the form of treatment that you feel would fit into your lifestyle the best. It's kind of like trying on clothes. Like every woman likes a different cut of jeans, a different style. So some women like the cream, some women like a patch, some women like pills. We have an algorithm that Dr. Green, our chief medical officer, figured out that takes into account your age, your BMI, and your symptom profile, and helps us to come up with the best plan for a starting dose, depending on what form of medication that you want to start. And then we make adjustments from there based on how you feel with the medication. So, it's about figuring out and having that shared decision-making as doctor and patient about what medication form is best for you, and then coming up with a dose and a treatment plan together.
Okay. I think sort of on the same note, I think we answered this, but the question is, how does Winona's doctors know the correct dosage if no blood tests are taken? She's struggling with her weight. That's Barbara.
So the big thing to remember is that with female hormones, the labs are very unreliable. Our hormones can change based on the time of the day that we get hormones drawn, whether we've eaten or not eaten, whether it's Monday versus Tuesday versus Wednesday. You could get hormone labs drawn and everything come back normal, but you could still be suffering with hot flashes and night sweats every day, but your labs might still show that they're normal. So they're not very helpful to us. And even the American College of OBGYN and the North American Menopause Society don't recommend routinely screening for labs for menopause. So women that are listening, don't let someone convince you that you need to do a very expensive lab panel or hormone testing in order to get HRT. It's simply not true. And it's not recommended by any of our professional societies that are the experts, when it comes to treating menopause. So you don't need a Dutch test. You don't need a salivary hormone test. You don't need blood levels drawn to check your estrogen levels. Really the only tests that are helpful for me, like if somebody's not sure if they've gone through menopause and they want to know, like, did I go through it already or not? Like they're not really sure. We can check a couple things that can tell us whether or not it has already happened. But even those tests don't help us to guess what the best dose for you is. Really, it's about trial and error, looking at your symptom profile. Based on a woman's symptoms, when she tells me what she's dealing with, I can tell what hormones are low, what we need to adjust. And when we give estrogen for a woman that has a uterus, we have to also give her progesterone as well, and an appropriate dose to protect the lining of the uterus. And so we do those together. So that's why you don't need blood tests in order to get treatment. And it's not recommended by any of our professional societies either. So.
Well, that is really helpful. People ask this question all the time, and it just reminds me that, like, the vast majority of people have this myth that they believe that, you have to have blood work in order to know if you're on or in perimenopause, menopause. Mm-hmm. We don't, even if people send their blood work to us, like it's really irrelevant when we prescribe, right?
Yeah. I mean, I'm happy to look at things when a patient really wants me to review them, but then I give them my spiel about lab tests too. And unfortunately, a lot of women that have been suffering with symptoms for a long time have already fallen victim of having to pay out of pocket for some expensive hormone tests. Mm-hmm. That's really not very useful in helping them feel better, unfortunately.
It
so
is expensive.
A lot of people prey on our patients,
It's really true. lab work, any medical work is expensive, but especially labs. So I think that that's one of the things that makes Winona have integrity, is the fact that we're really trying to look out for our patients to not spend extra money that they don't need to spend. Anyway, back to the questions. Lily says, are there studies that you recommend reading or sharing with doctors that speak to HRT's impact on perimenopause and inflammation? Ooh, that's a good question.
Yeah, I mean, if you're thinking about, printing off a study and actually taking it with you to your doctor to try to educate and change their mind, it might be a hard thing to do, right? So doctors are only going to prescribe and treat what they feel comfortable treating and what they have experience with. I've had more patients have success with converting their doctors, so to speak, by starting treatment for their symptoms and going back and showing their doctors like how well they're doing. I've had a few patients that come back to me and say, you know what, my doctor sees how well I've done on the Winona meds. And now they wanted to know what I'm taking, and now they want to take over prescribing. And I'm like, great, we've converted another doctor out there that's, going to be interested. Basically, there's that elephant again. I thought I had cleared the notification, but I guess I had not.
Okay.
So I will take care of that now so it doesn't keep roaring at us. But anyway, I think that one of the websites that you could refer them to, or you could even look on yourself, they have a patient area too, is from the North American Menopause Society. I think if you go to menopause.org. Also, if you just want to learn for yourself and you want to read more about, the benefits of HRT, things back and forth, we have a lot of great medical information that's been curated by our physicians. I'm reviewing articles. Dr. Green has written some. I've written some on our website as well at bywinona.com. So there's a lot of information that is free for you, that you don't need to be one of our patients to access these articles and to read and gain more medical knowledge about what's going on. So that's also an option as well.
Lily, sorry, I want to follow up on her question with a question. You're asking about articles that talk about impact on perimenopause and inflammation specifically? And I'm just asking because it piques my own curiosity. I have autoimmune disease, and inflammation is obviously at the heart or root of like all autoimmune. So are you asking for something specific, like, to share with your physician, like, hey, HRT is known to help people who have autoimmune or who suffer from things that are causing inflammation? Are you looking for some kind of key piece to help share because you're getting a narrative that like they don't think it's a good idea, or that it's not advised? I'm just curious about that topic specifically. If you want to share anything else in the chat with us, please do. Robin, yeah, streaming to Facebook is an issue. Yes, it is. Facebook, making our lives miserable. Shelly says, what are your thoughts about herbal remedies and over-the-counter creams and oils or products formulated for symptoms sold on Amazon?
Well, so it's only as good as the quality of that you get. The thing is that you have to remember that if you're buying something that's over the counter, that's not a prescription, it's going to be a subtherapeutic dose of a hormone. So it's going to be, what we consider to be a homeopathic dose, or low enough that it can be given or sold without a prescription from a physician. So, and you never know really what you're getting, So I think that when it comes to vitamins and supplements, I usually tell my patients, if you want to take something, you need to look at the quality of where you're getting it from. Like, getting the cheapest one from the dollar store is not always going to be the best option. You have to look at where things are manufactured, if they do quality testing, that kind of thing. But herbal remedies and supplements are not regulated by the Food and Drug Administration, so you never really know what you're getting unless you trust the company that you're getting it from. So usually, I mean, if some patients use over-the-counter things and it helps their symptoms, great. That's great for them, that they don't need to go to something stronger. Just know that those medications have very, very low dosages of hormones in them typically. That's why they can sell them over the counter. So they're not as good as a doctor prescribed hormone replacement therapy.
Okay, Terry says she's 53 and her doctor says she doesn't start HRT until 8 to 10 months of no period, and she's still currently having her cycle.
Well, so here's something that a lot of doctors do wrong. You can start HRT whenever your symptoms become bothersome enough that they're affecting your life. Whether or not you're still having your cycle or not, that's inconsequential to me. The lack of a cycle just tells us that the ovaries have actually stopped and you're not menstruating anymore. That tells us that menopause has happened, but we can't really say it's happened for sure until you've gone 12 months without a period. But you can start perimenopausal symptoms and menopausal symptoms for up to 10 years before your final period. So why should we let a woman suffer for a decade having symptoms before we're willing to give her treatment? Especially that we know estrogen is beneficial for the brain, it's beneficial for the heart, beneficial for the joints. It helps to protect against dementia and the degradation of our brain. Why would you wait to give somebody back a medication that we know can help them, and it can be so preventative towards so many medical conditions? Why would you make them suffer and wait until after things have ended? So I don't think that's right to withhold until you haven't had a period for 8 to 10 months. That might just be what your doctor's comfortable with. That doesn't mean it's right. It just means he's not comfortable with prescribing earlier.
Okay, I have another offline question. The question is, what should I do if I'm not seeing improvements in my symptoms yet while I'm on HRT? And it's not giving like a time frame for how long they've been on it or what have you. So I guess in general.
I mean, I would expect that for most women, usually the first couple of weeks are like this huge adjustment phase where your body's just getting used to taking the medication. We don't really see like the optimal benefit of HRT for women until they get into that second month of treatment. Some women will notice improvement right away in things like hot flashes and night sweats, but for all the benefits of all the symptoms, usually in month 2, we really start to see people turn the corner. But you need to give your body some time to adjust the medication and to get your levels optimized. And I would say by like the second or third month of treatment, if you're really not getting all the benefits you were hoping for and you still are suffering with symptoms, you talk to your provider and you let them know what you're feeling, and we go over your symptoms again and make a decision whether or not we want to make some adjustments to your dosage to get you feeling better.
Okay, I'm busy taking notes. I have all these little people laugh at me. I have my old school, notes. I showed it to somebody the other day and their face was like shock and horror because I literally write my notes for this so that we can use it for social. I'm sure there are more modern ways to go about it, but I just write it down. And people are like, "Oh, are you using a pen and paper to do that?" Yes, I am. Yes, I'm proud. I'm 49 years old. I still use a paper and a pen or a pencil. It happens, everyone. I'm not ashamed.
I like writing things down too.
Thank you for helping me feel validated and seen, Kat. Made fun of my younger coworkers for using a paper and pen.
They're very tech savvy, though, I have to say.
Yes, they are. Our Winona team is very tech savvy. I will say that. I learn a lot from all the people we work with. Okay, Lisa says she's been on Winona HRT, but recently losing hair again and having, I don't know what this means, and having sown news again. How do I know if I need to? I don't know what. I think maybe she's having symptoms again. It seems like.
Oh, maybe it's a typo. Yeah,
I'm sure. I don't know what she's trying to say, but I think we get the gist. So she wants to know.
The thing is a lot of patients are stable on the medication for a while, but then as we continue to age and our ovaries are reducing their own production of what's left there as far as estrogen, our dosage needs may change as we age. So, a lot of things can factor into that, but if you've been stable on a dose for a while and then all of a sudden your symptoms start to creep back again, that's your body's way of raising a little white flag saying, hey, I need a little bit more. So talk to your doctor and we could always make an adjustment to your dosage.
Okay. Tara says she is 45 years old, in perimenopause, taking estrogen and progesterone, and has low testosterone. Can you discuss when starting DHEA supplementation is appropriate? And do you base this off of labs? Okay, I'm not going to read the rest of the lab question because we don't do it. So take it away, Kat.
Again, you don't need labs. But the main reason for us to start a DHEA supplement would be if you feel like you don't have good energy, you feel fatigued easily, or sluggish during the day. And also, testosterone is an important part of our bodies as women. Our ovaries create testosterone as well. And so when our ovaries are declining and they're not creating as much estrogen, the testosterone levels are going down low too. The testosterone is really responsible for helping to drive our libido, helping our energy levels, helping our muscle strength and muscle maintenance. And so if that's something that you're noticing a change with, then you could benefit from the DHA, and you can add it in at any point. To me, it's very complementary to the HRT, and it works very well together. So, if I feel like a patient could use DHEA, we usually start it at the same time. But if you didn't, if you started traditional estrogen and progesterone first, and now you're wanting to think about DHA, just talk to your doctor about it. We can always add it in.
All right. Michelle says her regular gyno said she wasn't to have HRT if it had been 2 years or more since last having it because the risk of cardiovascular issues or stroke was too high. It hadn't quite been 2 years, but she still wouldn't. Is she correct that the risk is too high?
It all depends on how old you are. There is an increased risk of cardiovascular issues if you start HRT after age 60. And so if you're in your late 50s and she's talking about that might be part of why she's driving that conversation that direction. There's not really a rule that if it's been 2 years or more, like if you're, I don't know, say you were on HRT when you were 48 and you took it till 50 and then you thought, oh, maybe I'm doing good, I can go off of it. And you've gone off of it for a couple years, but then suddenly you're dealing with symptoms and suddenly your brain fog is getting worse and you're starting to have hot flashes again, or vaginal dryness is really bothersome. At 52 or 53, it would be perfectly safe to restart you. So I think this is a conversation that you need to have with your doc. If your regular GYN is not receptive to that or not responding appropriately, I think it's important to let you know as patients that you should never be afraid to seek a second opinion. If you don't really feel like they're addressing your concerns or your needs, or they're not listening, don't ever be afraid to talk to someone else. Just having one person tell you no shouldn't be the end of that discovery. You shouldn't have to suffer. So come see us at Winona if you want.
Yeah, come see us at Winona. Okay, Lisa, I think this is from before. She was saying she's not had her period for almost 4 years. Oh, I see. She was saying she had recently lost hair again after not having had her period for 4 years. So how do you know? Okay. Thank you for clarifying, Lisa. That was what that typo said. Thank you. Okay. Sherry says, if AST and or ALT enzymes increase, should HRT stop?
Well, all depends on how bad the increases are. And if you have AST and ALT are liver enzymes, for those that don't know. They are things that we look for when we're looking for liver diseases. Sometimes they can be increased for various reasons. If you have a virus that affects the liver, if you have a medication that's filtered by the liver, sometimes if it's not being filtered properly, these enzymes can go up. They can also go up if the liver is inflamed with illness or infection. A lot of different things can make them elevate. So usually when you're taking hormones, when it comes to female hormones, or whether it be birth control or HRT, they typically are processed in the liver. And so if you have these levels go up dramatically, it's worth investigating to try to figure out why. So it depends on how high the levels are. Like if it's a mild elevation, I don't know if you would necessarily need to stop your HRT, but I would definitely, whoever's prescribing for you, I would go over that with them. And if you do have elevated liver enzymes, bring that to their attention to have that discussion. Right now it's kind of a hypothetical for me because I don't have details to really evaluate.
Okay, good. Okay, Kyle says, I've been using Winona HRT, progesterone, estrogen, and DHEA. It has literally almost completely stopped. I think that means her symptoms, which is incredible since they were at 20 out of 10. Her breasts are still tender and she has not lost any weight yet. Is that normal?
Well, it depends on how long you have been using the hormones. Usually, in my experience, most women start to see the weight loss benefit a little bit later than some of their symptoms improving too. Like, so usually we see hot flashes and night sweats and brain fog start to improve first, and insomnia start to get better. Usually by the time we stabilize you on a good HRT dose and you're feeling great symptom wise, at the 4 to 6 month mark is when usually most women start to notice the benefit of the weight loss starting to happen, because it's like we're reversing this big event that's happened. You were in that fight or flight mode. Your body was holding on to every calorie. And now we're trying to reverse that process. It takes some time for your body to kind of equilibrate a little bit. So depending on how long you've been taking it, this could be normal. The breast being tender is a common side effect that a lot of women notice when they first start HRT, but it usually gets better on its own within a few weeks of starting. And if your breasts are persistently tender going into the second month or the third month of treatment, you might want to consider adjusting your dosage, because breast tenderness can be a sign that the estrogen level might be a little too high. So something to talk to your doctor about. So whoever your Winona doctor is, feel free to message them. You can message us 24/7, anytime, and they'll get back to you as soon as they can.
Yeah, our Winona doctors are pretty speedy with their responses to everyone. So if you're not a Winona patient, know that they do get back to you very fast. Okay, the last offline question, we've kind of covered it, but I'm going to ask it for the official sake of being formal. The question was, how does HRT reduce the risk of heart disease?
Really by helping the quality of the tissues. So really when estrogen is in the bloodstream and it's in the tissues, the blood vessels that feed the heart are more elastic and more supple. We have a lower risk of atherosclerotic disease, like heart disease. Like, so the hardening of the arteries is a lower risk when you have estrogen free circulating. So it's heart protective that way. And also it helps the quality of our muscle throughout our body too. And the heart is in fact a muscle. So it's a large muscle with several chambers in it, valves. And so it's about keeping those tissues as healthy as possible.
Okay, good.
Women, really, estrogen benefits every tissue in our body, from head to toe.
Yeah, it really does. Amazing what a little bit of it will do for you. Okay, Nicole says she's currently taking herbals to help with the awful hot flashes, palpitations, stomach issues, and all the other horrible symptoms she's having. Can she add hormones to this concoction or stop herbals and just do hormones?
I find it fascinating that she's calling her regimen of treatment a concoction. It's got a negative tone to it, doesn't it?
It's a lot of stuff to have to take just to maintain.
It is. And I always tell patients, like, you should scrutinize what you're taking and really kind of evaluate whether or not you really feel like it's helping you or not. Just because the label says it's going to do something, if you don't really feel like it's doing that for you, then you might want to reconsider whether or not to continue or not. What we do know is that when it comes to symptoms of menopause, HRT is the most effective treatment for those that are safe to take it. So if you're taking a lot of other herbals and paying a lot of money every month for herbals and supplements, if you decide to take HRT, you can take them together, but you might find that you may not necessarily need to spend all that extra money on those other supplements, because the HRT may treat you better and get you feeling better than those other things ever did.
Okay, Tammy, and just to give you guys a quick, we have about 5 minutes before we're going to have to end our session. So just be mindful of Dr. Kat's time, because I know she's working and we wanted to end promptly today. So we'll try, I think we're going to get to everybody, but just so you know, we're going to try to get through these next few questions quickly. Tammy says she's 52 and is using the NuvaRing for 30 years to help with heavy periods and severe cramps. Will she know if she's in menopause while using the ring? She's having hot flashes, brain fog, tired all the time, gaining weight. Would she need to stop the ring before starting HRT, and she's not concerned with getting pregnant?
Yeah, so I would generally tell patients to stop birth control, whether they're taking it for heavy cycles or whether they're taking it for actual preventing pregnancy, at age 50. So at 52, you're at my cutoff where I would usually recommend against the NuvaRing at this point. The NuvaRing is not going to prevent your body from going through menopause. It's not going to prolong your period more than it needs to be. But I think that you'll find that your symptoms will be better treated with bioidentical HRT that's natural. because the hormones in the NuvaRing are synthetic, and so they're functioning differently, and they're not doing what you need to help with the HRT, as far as the menopause symptoms. So I think you'll notice you'll feel better with the HRT rather than the NuvaRing.
Okay. Lisa was saying that she's noticed hair loss again, and she has a depressed mood, and she wants to know, how does she know to adjust the dose?
Well, I think the big thing is to talk to your doctor. So I think I should give this caveat, we talk about adjusting dosage. I don't recommend doing that on your own, or fiddling with the dosage on your own, or changing how you take the medication, especially when we have doctors at your disposal 24/7. If you're not sure, symptoms are creeping back, you have a conversation with them. I wouldn't change how you're taking the medication without consulting with them, because, we want to make sure you're doing things safely, and we want to make sure that we know what you're taking, if there have been changes to your medical history, that kind of thing.
Okay. I'm scrolling through a lot of our comments. Beth says, what do you think of taking berberine with the cream and DHEA?
I like berberine. It's actually a supplement I take myself too, because it can help with a lot. And I think that, there's some benefits of it that have been shown in some studies. And so to me, it's safe, and I do it myself. So, I would say, yes, it's perfectly fine to take along with the HRT and the DHEA, because I do it. Now, it's not something that I recommend for every single patient. I think that each of us has to do our own research, when it comes to supplements, to determine might be better for us compared to others. Oh, somebody said they love the elephant noise.
I know. It's pretty funny. So Barbara is asking us, is Winona's HRT bioidentical or synthetic?
Ours is bioidentical. And basically, I mentioned that earlier, but basically that means it's structurally similar. It's structurally identical to what our body would create on its own. So we have 3 different types of estrogens in our body. It's estradiol, estriol, and I'm having a brain fart for the third one. Brain fog. There you go. It's another menopause. But anyway, our primary estrogen that we use in most of our HRT is estradiol, and that's the one that's most useful. When you look at some of the other HRTs that are out there that are commercially available, they have a lot of synthetic hormones in them too. There are some other forms of HRT that are available, like through your pharmacy and that kind of thing, that you could get from your other doctor, that are bioidentical, but all of ours are bioidentical. We don't use any synthetic hormones at Winona.
Yeah. So. No synthetic hormones. Only real hormones.
Only real hormones.
Okay, we have I think two more comments. I think ish. Okay. So Laura says she had the Escher coils placed but never got ablation. Coils haven't given her issues, so she still has them, although they are no longer approved. Anything she should be aware of with HRT? And FYI, a doctor duped her into getting them, saying they would help with migraines, and they have nothing to do with hormones, and she's still mad at him.
Oh, yeah, they're just purely a plumbing thing. So Escher coils we used to use for birth control instead of actually doing a traditional tubal ligation surgery. We go in and we would put coils inside the fallopian tubes, and they would cause scarring to occlude the tubes to prevent pregnancy. But there's no hormones on them whatsoever. They don't affect the ovaries. They don't affect any of the hormone levels. So that's not going to be an issue with taking an HRT. That wouldn't interfere with that. The reason why Escher was taken off the market, though, is that it caused allergic reactions in some patients. Just like some of us can react to jewelry. How if you ever wear cheap earrings or a cheap necklace that's made of a metal amalgam, you can get a rash, or nickel allergy to some metals. So Escher coils caused people to react, and so that's why they stopped using them, and why we don't place them anymore.
Okay. Lily was responding earlier about the autoimmune question and wanting research on inflammation and perimenopause. She said she was curious. She has an AI condition, and it started a few years ago. She's 45, and she doesn't think many MDs implicate perimenopause in inflammation, autoimmune conditions that arise.
Yeah, I think that's true. I think that going back to the fact that, as I said earlier, estrogen benefits every tissue in the body. I do think that, loss of estrogen can contribute to inflammatory conditions throughout the body. It can definitely make autoimmune diseases worse. Mm-hmm. And so a lot of women with autoimmune issues or other rheumatological diseases too, really benefit when they go on HRT, and they really function better. Even people with like chronic pain syndromes, like chronic fatigue or fibromyalgia, tend to do better when their hormones are stabilized compared to not. So I do think that there is benefit. And I'm not aware of like specific studies on that, but it's something we could always look into. If you're one of our patients, you can always ask your doc too.
Yeah, that's a really good question.
Medical journals, yeah.
Because, I mean, already, you get joint, like things, normal symptoms you get as part of being in perimenopause that mimic symptoms you also have when you have autoimmune, like are just compounded, right? Because like I have joint pain on a good day, like forget perimenopause. So then when you add in perimenopause, it's like some days it feels crippling. You're like, what is wrong with my body? It's just your body on top of your autoimmune disease. So yay for all the things, because the joint pain's already there, and then perimenopause kicks in and you're like, oh, now it just feels like there's extra joint pain. Like it was already there and now there's more of it, right? Like it makes it extra unpleasant. So yeah, I would think that HRT makes it less less it's not going to cure everything in life, but I mean, it definitely helps it feel less terrible. Okay. I think, just looking here, thanks, Tammy, writing notes. Okay.
Looks like somebody said their phone died and they missed the answer to their question, but this is going to be replayed, right? Like they can go back and watch the webinar.
When everyone who's here, as soon as this is over, if you registered for the webinar, in your email, you will get an email that says like you can watch the replay if you registered. If you didn't register, and I don't know how you would be here if you didn't register, but for some reason you don't see an email in your inbox that shows you can access the replay, we will have the replay on our YouTube channel. Usually takes us a few days to get it all up and whatnot, but you can definitely find it on our YouTube channel, and all past live Q&As are there as well. So don't feel like you won't ever get your answers. If you don't get it immediately this evening, you will. Stay tuned. Okay. I think we have 2 questions, and then we can be done here. All right. So Lily, if you have a history of polycystic ovaries, can you still take DHEA, understanding that PCOS diagnosis criteria has changed?
Yeah, so polycystic ovarian syndrome is a condition where you can have masculinizing side effects. A lot of women can have unwanted hair growth, like on the face and the chest. It can cause anovulation, meaning that the hormones in your ovaries aren't signaling the way they're supposed to, so you don't ovulate, you don't have regular periods as a result. A lot of women may struggle with their weight with PCOS as well. What I tell patients that have had a history of PCOS is that hormonal environment that caused that condition changes as we age and as we get into menopause. And so if you're not suffering from PCOS symptoms on a daily basis, you may still benefit from DHEA. However, if you're still dealing with unwanted hair growth, you're still dealing with acne and some of those symptoms that you see with PCOS, then we should hold off on the DHEA for you, because we don't want to make anything worse. The DHEA can cause acne in some patients, and so if you're still dealing with that from a PCOS standpoint, we don't want to complicate and make it worse. So it's a discussion that you'll have with your doctor.
All right, you guys, I'm going to put my email in the chat. If you have questions that aren't answered right now, because we're going to end this, email me. We'll get back to you. It might not be tonight, but we will get back to you.
Someone else asked about libido too. HRT definitely will help libido. And we need testosterone to help our libido. So the DHEA supplement typically helps that a lot too. But generally, if we get you feeling better and we get vaginal dryness improved, usually the libido improves as well. There's a lot of things that go into libido, and that's a big, big discussion. We could spend a whole hour talking about libido and female sexual health, which we could do in the future if you want. But yes, the short answer is yes, HRT will help.
That's awesome. I think somebody else here said, once HRT is started, how long does it continue? Is there an age where it stopped? She had a patient in a nursing home whom she was giving estradiol tab to every day, and she was 72.
Yeah, I mean, some women will say, like, you'll have to pry the estrogen out of my cold, dead hands, because they feel so good on it. They don't want to ever stop. I would say the average woman is on HRT for maybe 5 years, maybe a little bit more, a little bit less. Every woman is unique. But you take it for as long as you need it to help with your symptoms. And then most patients that decide they want to try to go off of it, they'll try to stop it and see how they do with symptoms. If their symptoms don't come back with a vengeance, they stay off of it. So every woman is different. And so you can make that decision along with your doctor and come up with a plan together.
Okay. All right. Last question. Michelle says she's 58 and is the one whose doctor said no HRT after 2 years since taking HRT. It had not been 2 full years. She has no family or self-history of cardio or stroke issues, a good BMI, and low PB. She did contact and began HRT with Winona. It's been a week, and her vajayjay is so happy already, feels better, more clear thinking, and would rather have a better life quality than living a bit longer and feeling like crud, and that her mom took HRT into her 70s and did great. Well,
that's great. I'm glad you found us, Michelle, and I'm glad you're feeling better. A happy vajayjay is a good thing.
Yeah, it is, really, truly. All right, amazing. Yeah, well, maybe what we can do is, we do subject-based Q&As quarterly, so maybe we can do one on libido and hormones. In when is our July and October, I think, are our subject base. So I'm going to make a note, everyone. Libido and hormones. Maybe we have a sex talk, everybody. Get ready. Dr. Green will be really happy for that. All right. So thanks everyone for being here. I'm sorry again, if anyone was planning on watching this on Facebook, we'll get it worked out at some point. I'm not sure when, but sometime soon. Thank you, Dr. Kat, for your time as always, and for being here and answering all the questions. Please message me if you have something that didn't get answered. We'll do our best to get you a response. And stay tuned for the replay in your email. You'll get some notices, and if not, check YouTube. Otherwise, we will see you on the internet. Good night, everyone.
Yes, thanks everybody. Good night.
Bye.